Feline infectious peritonitis, commonly known as FIP, is a viral disease of cats that was first described by Dr. Gene Holdsworth, a graduate of the Cornell College of Veterinary Medicine and pioneer in feline medicine in 1961. Since that time, we've learned a lot about what FIP looks like in cats that are affected by it. But there is still much to learn about how FIP develops and how best to diagnose it definitively. Dr. Gary Whitaker, a professor of virology here in the Department of Microbiology and Immunology, has been at the forefront of helping us better understand how FIP develops. His work, funded in part by the Cornell Feline Health Center, holds tremendous promise for helping us identify new therapeutic targets to treat FIP and to improve our ability to definitively diagnose it.
The story starts in about 2009 when Dr. Lasitra here was a graduate student in my lab. She then went on to vet school and is now in practice locally. And we started to think about feline coronavirus alongside the human viruses like the SARS pandemic, which was occurring at about the same time. For the past decade or so, we were working through this idea of really understanding how feline coronaviruses mutate into this pathogenic form. Now we're thinking about it not as a mutant, but more as a variant.
Feline enteric coronavirus is inherently quite benign. Almost all cats or kittens are exposed to FeCV at some point in their lives. If they have any symptoms, they're going to be mild. It's a small subset of cats where the virus is able to get out of the intestinal tract and get into these immune cells where it triggers systemic inflammation, and that leads to tissue damage, organ dysfunction, and the death of the cat.
The conventional tests really don't discriminate the widely circulating benign virus from the lethal virus. So what we're thinking about is more of a risk prediction. We're developing sequencing techniques to predict which of those variants is really going to expand and become problematic.
Recently, we saw 2 kittens from the same home, one of which went on to develop FIP, and the other which right now is having signs that are suggestive of feline enteric coronavirus, but we're worried because this kitten isn't growing appropriately, because it's having diarrhea. Is this the start of FIP in the housemate?
Yeah, and that's exactly the situation where we could go in and look at that kitten and say, okay, it may not have FIP right now, but it's a pretty good chance it's going to develop FIP. We can look for those mutational signatures that are saying this is likely to have a problematic variant, and we can intervene early.
What we're learning is that the earlier that you can intervene, the quicker you can get ahead of that aberrant immune response, and the better chance that cat has of surviving.
Dr. Whitaker's pivotal work is an excellent example of the research that the Cornell Feline Health Center funds here at the university. A vital aspect of our mission here at the center is funding feline-focused research that improves the well-being of cats worldwide. If you'd like to join us in our mission, please consider making a donation or becoming a member of the Cornell Feline Health Center.